400 hours, you are called to a residence for a 4-year-old child with difficulty breathing. Upon arrival, you find an ill-appearing 4-year-old child seated upright in the edge of a recliner. The child states that it hurts to swallow. She is leaning forward in the tripod position and has significant drooling and work of breathing. The mother tells you that her daughter had not been feeling well most of the day, but wasn't having any breathing issues when she went to bed at 9 p.m. last night. She awoke approximately 20 minutes ago complaining of not being able to breathe.
Okay. Proper PPE. Is my scene safe?
Yes.
Nature of illness is having trouble breathing and swallowing and drooling a lot. Oh my gosh. There's one patient. I am going to call for ALS because it's a 4-year-old not being able to breathe, and that's something that I would like some help with, probably. And then I don't think I need C-spine. So then my general impression of the patient is she's sitting in the tripod position, drooling, having trouble breathing. She's 4. Level
It also says that she looks anxious, but talks only a little.
Okay, anxious but talking. So she's alert. I think this is life-threatening because it's a child who can't breathe or swallow. Okay, so assessing her airway. Can I have you open your mouth, honey? Stop. Okay, when I look inside her mouth, I don't know if this is going to tell you. Do I see, like, swelling or redness?
When you look in her mouth,
or anything obstructing?
Nothing obstructing. I just see significant drooling, but nothing about swelling or anything.
Okay. If she's got adequate chest rise and fall?
Symmetrical rise and fall of the chest.
Okay, and then if I put a SpO2 on her finger?
92%.
92? Okay. That's low. You said she seemed anxious?
Yep.
Okay, so I'm going to ask her mom to do blow-by oxygen because she's super young and I don't want to try and mess with her too much. And then I'd put her on, so it'd be in a non-rebreather. I'd probably go 15 just so she can get as much oxygen with the blow-by as possible. If I check her pulse, is it strong, weak, regular?
Radial pulse is strong and equal.
Okay, good deal. And then if I look at her skin, what's her color and temperature and condition?
Pink, hot, and diaphoretic. Hot is all capitalized.
Okay, if I take her temperature, do you know her temp?
103.4.
Okay. This is a load and go, so I'd get her to the nearest hospital or to ALS as soon as possible. Is there any major bleeding anywhere?
No.
Okay. Okay, so get her in the ambulance or get her going. So I'd ask her mother her history questions, or her caregiver, whoever's with her, I guess, you said this started about 20 minutes ago? Onset was 20 minutes?
Yes.
Okay. And she doesn't know what provoked it?
Nope.
Okay. And then quality.
Not applicable.
Not applicable. If I ask her if it hurts anywhere else, or where it hurts, what does she say?
Not applicable.
Okay. Severity, she's 4, she's not going to really know how to rate 1 to 10.
It just says moderate respiratory distress.
Okay. And then time?
Time was approximately 20 minutes.
Do we know, like, anything that brought this on?
Nothing that brought it on is stated.
Or makes it worse?
It doesn't say what makes it worse, but sitting forward makes it easier to breathe.
Okay. Good deal. And then moving into past medical history, does she have any allergies?
Augmentin.
Is she on any medications?
Acetaminophen for pain and fever.
Okay.
Acetaminophen.
Acetaminophen.
Yeah.
Past medical history?
None.
When was the last time she ate? Okay.
Lunch yesterday, she ate yogurt.
Okay, so she hasn't eaten in like 24 hours then? Because you said it's 14.
4 a.m. right now.
Oh, it's 4 a.m.? Okay.
Mm-hmm.
I thought you said 1400.
If I did, that was my mistake.
Okay.
4 a.m.
And then events leading up to this, she's just had the fever and like irritation in her throat?
It says sleeping.
Okay.
Signs and symptoms is sore throat, difficulty breathing. Events leading up to is sleeping.
Difficulty breathing, sore throat. Okay, so I'm gonna try and get her to talk and like fuss as little as possible, just in case it is like a swollen epiglottis. That's not good. Don't want anything to mess with that. If I take a blood pressure,
104/62.
104/62. What is her respiration rate?
33.
33. And pulse rate?
128.
I can't focus, like, my brain can't function, it's fine. If I check her, like, circulation in her fingers, her cap refill?
Cap refill. It does not say.
Okay, that's fine. Can I get a SpO2 again with oxygen?
92.
Still at 92?
With oxygen, 97.
Okie dokie. If I check her pupils.
Pearl.
Okay. Okie dokie. Okay, so my field impression is that I think she could have a swollen epiglottis, like I said earlier, so I'm not going to make her do much. And then I put her on blow-by oxygen just to make sure she got some oxygen, but didn't make her fuss too much because I don't want her to make too much noise and be too upset and irritate her throat any more than it is. I am going to reassess her vitals every 5 minutes on the way to the hospital or to ALS. And then my report. So we have a 4-year-old little girl who has who's had a sore throat and kind of difficulty breathing since last night. It's 4 a.m. She hasn't eaten since yesterday at lunch. She is allergic to augmentin. She is on acetaminophen because her fever is super high at 103.4. She's drooling a lot. She's very upset. She's on 15 liters of blow by oxygen, which brought her O2 stat from 92 to 97. Her blood pressure is 104/62. Her respiration rate is 33. Her heart rate is 128. Yeah, that's all I got. So we're done now.